naturally near the entrance on the periphery, so around the ear canal wall. However, the eardrum was fully visible, so the patient had no symptoms in the left ear, so we leave that. That wax and skin is naturally migrating. This, however, the patient's right ear was fully blocked with this really hard, really matted plug of wax and dead skin. And I just went in with an ear hook, and there's a bit of an opening at the roof where we are now, the ear canal. I'm trying to glide it in and get behind it, but it was so hard that this ear hook, it's almost like a pole vault in the Olympics, where when someone's using a pole vault to get over the great height, the distance over I don't know what you call it actually, the bar, and that pole vault can almost bend backwards and looks like it's going to snap. And same with this ear hook. So I'm going to have to change tact in a moment. I'm just going to have one more go, I think. I'm just trying to roll it forwards, but it's just like stone. So I've brought it slightly more forwards, but it was extremely, extremely hard. And in a moment, I'm going to use some Henkel forceps, which I've used recently as well. I think this is the moment where I use the forceps. So for this, it's got a larger surface area, therefore probably a bit more of a better grip. And because it was so hard and embedded, a normal forceps I don't think would have worked. And there we are. I put the still image of that bundle of hair and wax on my Facebook page the other day. So if you're following, or if you want to follow me on Facebook, just type in the Hair Clinic, and similarly on Instagram. And quite a few comments on Facebook made reference to that plug of matted hair and skin looking like a bird's nest, hence the title of the video. So post-procedure, the patient's eardrum is nice and healthy. We're just going to go back in. There we are, it's their tympanic membrane, their eardrum. And there's the still image of that bird's nest. Okay, so because it's a short video, it's going to give me an opportunity to go through some of the questions I received from yesterday's video. One of the first questions was whether I offer online consultations. Unfortunately, I don't, and that's more for the benefit of yourself, the patient, because until I examine an ear properly and perform various tests that need to be done in person, it's going to be very, very hard to give anyone a diagnosis. And I don't want anyone to go away and feeling shortchanged. I spoke to Neil online, and he didn't really say much or diagnose me with much, and that's going to be the reality, because without examining the ear and performing various assessments in person, it's going to be very hard. There's so many ear pathologies and conditions, and the symptoms quite often overlap. So unfortunately, I don't. I mean, if it did, it would be very financially rewarding for myself, I'm sure, but it's more to protect yourselves, and so it's always best to see someone locally in person who can do a face-to-face examination. Another question was whether piercings can affect your hearing. So no, the piercings don't obstruct the pathway of sound through the ear canal or through the eardrum or the organ of hearing, the cochlea, or the auditory nerve to the brain, or the auditory cortex in the brain itself. So no piercings, unless they're blocking the ear canal, are not going to affect anyone's hearing. Another question was whether ear infections can be seasonal. I suppose they can. So otitis media, so a middle ear infection, typically in the winter months, that's when people are more likely to get blocked nasal passages, so a blocked eustachian tube, which then causes a retraction of the eardrum, which then can lead to a buildup of fluid behind the eardrum called glue ear, which then can perforate the eardrum. Also, if you're in humid environments, you're more likely to get fungal ear infection. So yes, it can. That leads on to another question. I think one viewer advised that they've got fluid behind the eardrums, and they've given antibiotics but no other treatment, and they were worried whether this can escalate. Quite often it can resolve itself, but again, we just don't know, individual to individual. Sometimes that fluid, so we call it middle ear effusion, can get infected and become viscous and turn into glue ear, which then can cause significant hearing loss, and it potentially that fluid can rupture your eardrum. So I would if it was me, I would chase up with the GP, get referred to see an ENT doctor if possible as well. Another question from yesterday's video was whether the discharge in the ear comes from behind the eardrum or for the skin in the ear canal. Can be both. You can get discharge, we just made reference to that glue ear, so infected discharge behind the eardrum that can rupture the eardrum, so it won't seep through the skin but it'll rupture through and cause a perforation. Or quite often when you've got otitis externa, so external ear infection, the discharge actually comes from the dead skin on the ear canal itself, so it can be both. Someone else asked whether, I hope I got the question correct. As you know, quite often now when you have your temperature checked, it's a probe, a little silicone probe into your ear canal which checks your temperature, and if wax can affect that. Potentially, because if you've got a blocked ear canal with wax, it can cause increased temperature, humidity. Of course, if you've got an ear infection, that's going to cause increased humidity. If you have got a lot of wax, it could potentially block the probe as well. So yes, potentially. I don't know enough about how the ear probes work, but in theory, yes, it can affect it. I think someone else asked why I don't use the same lighting. I do, so I'm slightly confused by that question. It's the same device. Sometimes we reduce the brightness so we don't get a reflection, but I'm not aware of any difference in the lighting at all. So I'm not a bit slightly confused by that, but I can assure you it's the same equipment, the iClearScope, there's no difference. In fact, I'm using my original device, 6 years, it's going strong and it's still performing as it should. I think there's another question from the same person relating to why I don't show all the debris at the end. It is a tricky one, I do apologise, I know you guys like watching it. It's just sometimes it's so busy between clinics and taking additional photos. I've got patients waiting, so I've got to clean up, ready for the next one. So wherever possible, I do try and take still images and record, measure it or weigh it, but clinics has been so busy at the present, so it's very hard for me to do that. So it is noted, and I will make an effort wherever possible to do so. Someone else asked whether if there's anything that can be done if they've lost hearing completely in one ear due to a viral infection. The answer to that is yes, there's potentially things that can be done, like a bone-anchored hearing aid or a cross hearing aid, potentially a cochlear implant, but you would have to undergo thorough assessment. So do find a good local audiologist who can assess you and see if there is any potential things that can be done. Going back to yesterday's procedure, someone else asked whether all that dry, yellow, dead, flaky skin at the entrance of the ear will resolve. Yes, so that's part of the eczema psoriasis. So once they've had the appropriate medication, hopefully that would also eradicate itself. Someone asked about my opinions about whether the fight or flight response can affect your hearing. It's not really my specialist area, that, but potentially, yeah, any stress, chemical change can, I suspect, affect the performance of the organ of hearing and or the hearing nerve, also the auditory cortex. So it's possible, but I don't want to, it's not my specialist area, that, but potentially, yes, it can do, because I know stress can cause temporary or permanent hearing loss. I've had a couple of patients who've lost their loved ones and they had a sudden hearing loss as a result. Someone wanted to know whether I can recommend someone in Belfast. Now, we have got a website at www.clearwax.co.uk. Enter your postcode and you can find your nearest Clearwax specialist there. Top of my head, I can't remember if we've got anyone in Belfast, but if you do visit the website, enter your postcode, city, and you will see anyone local to you there. Someone asked whether it's easier for me to remove wet or dry wax. Most definitely dry wax. Good question that was. Someone wanted to know whether I look in my friends and family's ears. Yes, I do. There's no embarrassment with them there, that they don't mind. Someone wanted to know my thoughts on ear candles. It's a big no-no. I've mentioned it quite a lot in my other videos. Stay away from them, they're dangerous. I was trying to keep this video under 10 minutes just because it allows me to upload to LinkedIn and also Instagram, but I think it's going to go over because of all the questions. Someone else wanted to know how long Clearwax delegates train. So to be a candidate, you must be a suitably qualified ear or healthcare professional. We've got a list on our website. They then undergo about 4 to 6 hours online theoretical training, and then it's a full practical training. And being successfully qualified from our course, it's a bit like learning to drive a car, you pass your driving test, but the real learning then occurs when you start driving by yourself. So it's similar to that with our clear wax delegates. Someone wanted to know whether one's hearing can be affected by Bell's palsy. Yes, potentially, depending upon the cause of Bell's palsy. So Bell's palsy typically is inflammation, infection of the facial nerve, which runs near the stapes foot plate, so near the organ on the organ of hearing. There could also be some benign tissue growth deep in the ear that can affect your facial nerve. So yes, but not always. Another question was relating to, I'm sure, Dr. Zhao, I think, from YouTube, and the extreme severe infections Dr. Zhao gets, and whether it's due to a delay in patients going for treatment. I think Dr. Zhao isn't actually an ENT doctor, if I'm correct, which I think the patient obviously made reference to in their comment. So naturally, they're probably going to be doing more cases under general or local anaesthetics, so probably more severe cases. I think in the Far East, potentially, you get more keratosis obturans, skin buildup, because people in the Far East generally suffer from more dry earwax, so high composition of dry skin, and also canal cholesteatomas, again, so when you get, or even a normal cholesteatoma, so skin, dead skin plugs in the attic of the eardrum that grow inwards in the middle ear and towards the brain. You can get some canal cholesteatoma, so these infectious skin plugs that embed itself within the canal wall. So I wouldn't say it's potentially a delay to treatment. I just think partly you're going to see more of those procedures on his channel because he's an ENT, and you're more likely to get those cases, I believe, in the Far East because it's more skin related. And so people in the Far East and North America have more dry wax, more dead keratin skin compared to European or African patients, so potential reason why. Someone else asked, what is the white foam that I put in the ear after cleaning it yesterday? I'm not sure I put there's a white foam or anything like that, so I'm not sure if you're watching the correct video. I accidentally commented on my procedure, so I'm a bit confused by that. Someone wanted to know what's the best way of cleaning the ears on a daily basis. The answer to that is actually don't do anything. Your ears self-cleanse themselves. The skin that lines the ear canal and the eardrum, as it dies, it naturally sheds and migrates sideways out of the ear, and any wax or anything on top of the skin will also naturally come out as the skin migrates. Avoid water in your ears, that's important. Don't poke and prod in your ears. And you can put some olive oil spray. So this is spray over the counter from the pharmacy, especially designed for safe use in the ear. So it's medical grade oil, which will just help moisturize the skin in the ear canal. You can use that once a week if you want. Other than that, leave your ears well alone. I think someone wanted to know if there's any treatments for tinnitus. I think I answered that not yesterday's video, the day before, but in short, there's no silver bullet that can eradicate your tinnitus, but there is potential treatments that can help. Again, it's a huge topic. You can. There's some specialist tinnitus audiologists out there, so it's such a big niche area. But go and speak to a good local audiologist who can go through all that with you. There are potential solutions. It could be masking devices, hearing aids if you've got hearing loss, cognitive behavioural therapy, potential changes in your diet and day-to-day lifestyle. So it depends on the cause of your tinnitus as well. So do speak to a good audiologist who may be able to help you. Someone asked whether children are more likely to get infections, and as you get older, you're less prone to get ear infections. Yes, just children, you're more likely to get upper respiratory tract infections, which can then cause blockage of the eustachian tube, or an infection to go up the eustachian tube even into the middle ear, leading to otitis media. So yes, that is very true. And as children get older, they're less likely to get upper respiratory tract infections. The eustachian tube is wider, more vertical, so gravity helps drain any fluid that collects behind the eardrum in the middle ear cavity. Someone asked whether we've trained anyone in America. Unfortunately, no, not yet. The reason for that is endoscopic earwax removal training. It's high-level training required, and we often get people contacting us saying they can do earwax removal using a different visualization technique. Can we just buy the device? And they struggle. We had a training course today, and Unfortunately, I had to fail a couple of the delegates. They struggled a bit with the technique, and these are audiologists, mind you. So it's not an easy skill, and obviously it needs face-to-face training. You need to need me to show you or the specialist how to do the procedure. I can't say much more. We've got loads of exciting plans for this year. Obviously, COVID has halted the progression of the iClear scope. We've got loads of things going on. I can't say much more than that. But currently, no, we haven't got anyone in America, unfortunately. But if you go to a good ENT specialist in America, even if they don't use an endoscope and they use a microscope, I'm pretty sure you'll get very high-level treatment. Someone wanted to know if they've got intermittent stuffy blocked ears, I think, and it's a bit itchy. And the eardrum can be slightly red, but the doctor feels it's okay. It could be some otitis externa. So if you haven't got a perforation of your eardrum, you can use some acetic acid, so ear calm spray, that might help. Or you could have eustachian tube dysfunction, so blockage of the tube that equalises the air pressure behind the eardrum. That can lead to negative or positive pressure in the ear, be it in the middle ear, which can sometimes cause vascularis, so inflammation of the eardrum. So again, it's difficult. Pop in to see a good local audiologist or ENT if you feel you're not getting very far with the doctors. Another question was how difficult it is to gauge depth in the ear with the iClear scope. So with an iClear scope, you're not using binocular or stereoscopic vision, so that's when you use both eyes to judge the distance. So if you were trying to touch an object on a table that's away from you and you close one eye and then you keep both eyes open, you'll find it a lot easier to do it with both eyes because you've got binocular vision. So you don't have that with endoscopic earwax removal on a 2D screen. However, depth perception can be acquired using monocular vision, which is what we're doing with an iClear scope. You judge the landmarks in the ear, so the first and second band, the isthmus, shadows in the ear, certain landmarks in the ear canal. When you're going in and out with the endoscope as well, you can judge, does that speed of going forwards and backwards can help you relate to where you are in the ear canal. It's a phenomenon called motion parallax. So there is many cues available to gain depth perception. As if you've seen some of my videos, I'm not quite often in the eardrum. So for me, I can judge depth perception in the ear with an iClear scope, endoscope, just as well as I can with a microscope. There's no difference. Another question was, what is my favourite type of procedure? My favourite type of procedure is any procedure, believe it or not, that involves me removing wax or dead skin off the eardrum. I just really enjoy working and removing stuff delicately off the eardrum. And the final question relates to, someone mentioned when they sleep on the ear, they can feel a sensation of fluid on that side. Kind of probably answered it with one of the early ones. You may have eustachian tube dysfunction or middle ear effusion, so a build-up of fluid behind your eardrum that is unable to drain away because you've got a blocked eustachian tube. So again, go and see your doctor or local audiologist. They can do some pressure testing in your middle ear to see what the potential cause is. Well, I hope you enjoyed that video, guys. I think the video is only a couple of minutes long and I ended up speaking for about 19 minutes answering the questions. I hope that was useful for you guys. If you are going to ask questions, trying to make them kind of more general, because I can't give individual clinical advice. And I don't think, actually looking into the questions, I don't think anyone particularly was asking for that. They're just asking for tips and tricks, which is very good. Well, take care, have a great weekend. I shall speak to you all soon.